Hey guys, my name is Richard Ogachi. Thank you so much for watching and subscribing to my YouTube channel and watching the videos. I appreciate and I'm so grateful because I've seen a couple of guys and friends and people just following and watching my videos. Thank you so much, and I promise to keep improving on these videos and be able to share stories and conversations that have positive impact and that we may have good experiences. In healthcare, you find that when you're working as a registered nurse or a physician or physical therapist or maybe a physician assistant or clinical officer, you find that mostly you deal with different kind of issues, emotionally, physically, and even spiritually, connecting and being able to be there for patients and being able to be there for people in great need, in pain, who need you to listen and hold their hands in the difficult and tough moments they are in the hospital. So, as I said, my name is Richard Ogachi. I ask that you follow and subscribe to my YouTube channel. And I appreciate and I know that you comment on the videos so that at least you can give feedback and I can know where to improve and what type of content that you're looking to listen to. Thank you so much. So today's video, I had promised to do a video on experiences as a male nurse. And today I'm going to talk about 5 worst experiences as a male nurse. So number one is being a registered nurse. It's a field that is, nursing is a field that is women dominated, and most of the nurses are actually women. So you find that some people have this kind of assumption that almost all the time when you see uh, a male as a registered nurse, it's sometimes in the hospital, usually almost all the time, patients confuse and always say that I'm the physician. And it's usually a big and an assumption that cuts across. I thought maybe initially when I was practicing in Africa, I thought maybe over in the US things are different, but they are almost the same. You find that sometimes I can get into a patient room and I explain myself like I will be your nurse today and clearly tell them what I'm gonna do as a nurse. But almost all the time you find them again, like when they're having conversation with the family in the patient room, they start saying, or they keep referring me as the doctor. And sometimes when the physician comes in the room, when I'm in the room and it's a woman or it's a female, you find them, they jump and they actually start now referring to her as the nurse. So it's a field or it's a profession that has more women anyway. And at times I think also this poses a great challenge because even in the past we have uh, mostly actually men never used to be nurses anyways. So it's a new venture, it's a new kind of thing because actually I even saw in my NCLEX exams, there were some kind of scenarios that were being given and they were referring male nurses as minority. I don't know if I think it's around maybe 10% of the total number of nurses are men. That's, I think we have like 30 million nurses worldwide. So 10% is significantly low number, but I think we are seeing more male nurses and more male getting into the nursing industry. And I hope it's gonna maybe also now cause like a kind of a balance. But it's always uh, experiences that when you are the male nurse, and then, personally, what I've experienced in different scenarios, working in units, almost all the time, I find like I'm the only male nurse in the unit almost all the time. So, significantly, you tend to relate more to most of the registered nurses who are mostly women. So it's like there is that connotation or assumption that it's a women profession anyways. But you know now we are also able to give these nursing services, and as equally as women can do so. uh, that's one. Then two, almost all the time, sometimes, as a male nurse, you will see at times you get to be given or asked to help in one of maybe heaviest patients in the unit. You sometimes are supposed to be the one to be used to handle maybe super confused patients, or maybe patients who are having maybe manic behaviors or behavioral issues. You always tend to have men uh, try to get involved or handle this kind of patient. So you find at times, most times, you stand up maybe a risk, or at least, being able to put some masculine energy to help calm a patient. Or sometimes when you're putting restraints, it's always it's always I'm always called to help in that way. And I'm not complaining, it's not a problem, but I think also it's like a downside. You're now being used as a male nurse because you sometimes handle most confused patients, delirious patients, patients with psychiatric issues. You're put at the front, to handle the patient or to handle them, to help maybe administer maybe diazepams or lorazepams, and usually happens that way. And then number three, most times I think um, sometimes because it's a women dominated industry and you have more women in nursing, the men or the male nurse usually becomes like a bay. Like, I've now come to interact with a popular statement that I didn't even experience before. They say that maybe your work husband or work wife. I actually don't like that. I don't like that statement or that kind of relationship, to say that you are my work wife, you are my work husband. Come on, like I don't like it. I don't like it. But sometimes you tend to engage women and work with them, and I think mostly when you work with women, they're more like vulnerable. You find them like sharing. I think sometimes maybe they share too much, or they get to, like, they're vulnerable, they share a lot. You find getting entanglements into issues with maybe families, because women are open, they tend to share more, so they will share experiences and then they share with their families. So you find you may end up getting entangled into their relationships or their communications in their families, and that's, you get involved. So as a male nurse, I think because the cordial relationship between men and women, sometimes I think men women relations sometimes is cordial. Male and women energy, there's kind of attraction, and they get work together even better. Sometimes, at times, maybe there are people you like, there are people you may not like. So it's not like it's a cast on stone. But mostly I've found myself like in situations where some women, like multiple, may like you, and they want to like engage at that level, and they end up now like drawing who is close to who sometimes. And at times it's hard to deal with. and it's difficult to handle. But I think also, number four, I think the fourth point is, or I find most people also now they say that men are getting to nursing because of the money. I don't think really maybe that's the only reason, maybe yes, and at times I think it's no, you know we have some of the nurses who are male nurses who are so good with patient care. They are compassionate. They are able to give like the best care. I've seen very good male nurses. It's not like they are only getting there for the money, because then it means maybe you are only focused on the money. You make a good income as a registered nurse, but you know it's always a industry or a field or a career where you you really deal with a lot, because you have a lot of anxiety and a lot of sacrifice. You go out of your way, and I believe, honestly speaking, working as a registered nurse, I don't think you can be paid enough because of what you handle. It's a field where there's a lot of stress, and there's a lot of emotions involved. There's a lot of sacrificing you have to do as a nurse. And if you get there as like you're going for the money, really you end up getting a lot of burnout, and getting, I mean, emotionally like down, and in the end you really get tired. So I think, mm, for me, I think it's an industry that I've seen. I've grown as a nurse. I've worked in many organizations. I've been of help to many people, and then like I've met many people, taken care of so many people in different areas: long-term care, critical care, public health as outpatients, and at the community level. I think it's a field that I enjoy, and I really have a lot of fun most times. And seeing having systems around healthcare, be running systems. And this is one of the observations I think I've made. You find that women, they most of the time you find like women charges who are running these companies, healthcare companies like hospitals. They are mostly involved, being the unit directors, unit managers, being the director of nursing. Women are really very good with like management, and because they are naturally just nurturers, so they are actually, what I've seen mostly, I can talk about working with women mostly. It's They are very loyal. They almost all the time they work more in hospitals, in long-term care facilities, in even small hospitals, or wherever they go. They they are likely to stay there longer as compared to like male or their male counterparts. I've also been involved like directly hiring registered nurses, both women and men. You find that in the most times, we retain the positions that I've been involved in hiring. You retain male nurses shorter than female counterparts, because you see, they most times the men come in, and they like get used with the area, and then some at times they become complacent and they don't care anymore. Maybe they want to pursue other ventures. It's always the women who stay longer. They stay longer in the positions. They do more. They go out of their way. They make more sacrifices for the companies. So, and then number five, the some of the like worst experiences, I think also, I think male dancers work longer, and not even longer actually. I can say male nurses, they need to work more. You find male nurses, they pick more shift, they work longer hours. In the most part, most of them, I don't mean like women don't work long hours. They do, but you find Men will go out of their way and they will work more shifts, they will pick more shifts, they'll have more than one job almost all the time. And this is because, as a male nurse, you are the man, or if you have a family, you're the husband. And at times, of course, in the family setup, a lot is expected from the men. You are supposed to do more, of course. I don't mean that women can't do more, but in a family setup, you find that, of course, the man is supposed to run the family. And of course, I think you really need to go out of your way to make more income for the family. So you find men picking more shifts, working long hours at times. And because you see, like when I try to compare the equivalent of most of the, actually from the personal experiences I've had, I've worked with women who are wives to people who have very senior or very nice, well paying jobs. Like, for example, I worked with one of the ladies who was the wife to like a cabinet secretary in Kenya. So you find that for her, she shows up at work and she has whatever income she gets is for her own use, because the husband is always, he provides everything. And they don't have too much pressure. So in this particular case now, I am the husband. I am the husband. I'm supposed to provide, I'm supposed to lead, I'm supposed to provide financial resources to my family and kid. And then you find, so you almost all the time go out of your way, not even out of your way, you do more. I see male nurses mostly working more and long shifts and more hours, of course, because of that same like sacrifice. But you see, it's always like not really the worst experience to say that it's a bad career you can do or profession. It's a good profession, but there's a lot of sacrifices to make, and you are gonna find that you're gonna go out of your way, not necessarily because of the pay, but because you have to be there for the patients. You have to work long shifts sometimes. Like, for example, the other day when we were at work, there was like snowstorms. They say, okay, some codes have been announced and you can't go home, or you have to work more than 12 hours at times. So it's it's what it is, because physicians and nurses, people work in healthcare, really, they make a lot of sacrifice. They work long shift. Look at, for example, the medical doctors. They have switchboards in the house. Their phones are always on, like they are expected to respond, being on call, and they are supposed to be woken up at night. It's a big sacrifice. It's a industry or field that you only cannot come looking for the money. You have to be ready to sacrifice and to offer like good service. You have to be ready to sacrifice and talk to people, make people feel better, make people feel like they're being taken care of, and be there. Like, I've always found myself having a situations where um after working for some time, you get to learn how to handle people when you're taking care of them. It's been work in progress, but I've got some to a point where I'm always like on the game, like I can do more. I have my own challenges, like sometimes I get challenges with multitasking, like taking care of many patients, and you're supposed to follow up on different things. I get short, but it's an enjoyable experience. It's I like when it's different experiences. You get meet different people, you share experiences, you talk to them, and being there, keeping listening to them, keep quiet sometimes when there are patients who've received like bad results, or some they are going through like a condition that is not curable. It always needs a lot of emotional engagement, empathy being there, like be putting yourself in the shoe of the patient without necessarily getting emotionally attached. It's always good. It's good experiences. So thank you so much for watching, and I ask that you guys subscribe to my YouTube channel. Remember, my name is Richard Ogachi. And I ask that if you agree with what I've said, you can put down a comment. Just put a comment on the comment section, and just let me know what you want me to talk about as a registered nurse, or the different kind of experiences. Thank you so much. Just leave a comment and share with your friends. Thank you so much, and I will see you next time.